So, hello, good evening, everyone. So, today we'll be discussing embryology. So, dear students, before you go into embryology, you should have a very good knowledge and you should know what all areas you need to cover. So, first and foremost, you need to know all about the fertilization chapter. So, what is blastocele, right? What is the notochord? What is primitive streak? So the clinical application of all those things you should be knowing. What is morula? Those things. And then you have got the second most important one is the derivatives of pharyngeal arches. First arch, second arch, third arch, fourth, sixth arch. So in each arch there are derivatives. So this derivatives also you should be well aware of. It is extremely important. Then the development of tongue, development of thyroid, and then other things you should know. Basic thing is the chromosomes chapter, which I am very sure you should be reading it and you would have read it. So a lot of applications type questions come from chromosome anomalies, Klinefelter syndrome, Turner syndrome. So all the questions are set basically from this area. And not to forget your development of face chapter, which is extremely important. So all the anomalies of the development of face, that is all the areas which you need to focus on. So today in these sessions, I will be going one by one and giving you brief MCQs here and there. So for you to understand how to read about embryology. So starting with first and foremost, the chapter of gametogenesis. So here the spermatozoa and the ovum, the structures, the parts you should know. What is mitosis, meiosis that you have already studied. So a basic MCQs which was there in your previous exams. The number of somatic chromosomes are 44 in number. So this is a high yielding fact. Number of sex chromosomes are 2. So 44 plus 2 is 46. So 23 pairs it is called. So what is spermatogenesis? So it is a process by which the spermatozoa are produced in the testis. The production of spermatozoa is called spermatogenesis and it occurs in testis. What is spermiogenesis? The spermatids are transformed into motile spermatozoa. Motile means active, which will go and fertilize. So that is why it's extremely important to know the definitions. They may give you a definition and four options what it is, whether it is spermatid, it is spermatozoa, or some other names, similar names they will give you. Spermatogonia, spermatocyte, like that they will give you, and then you should know to pick the correct answer. So this is basically the definitions. So spermatid is a singular term, singular. So it's a small cell with the basic structure, that is Golgi complex will be there. The powerhouse will be mitochondria and there will be centrioles. So just a second. There will be centrioles. Yes. So then you should be completely aware of the structures, the spermatozoa and your ovum structure also you should know, because everything begins from the ovum structure. Later when the fertilization happens, the things develop from there only. Okay, let's go back. Yes, just a second. So then you have some definitions. Just give me a second. Yes. So spermatid is a singular term. So it is a small cell with Golgi complex, mitochondria, and centriole will be there. So it is a spherical nucleus. Then you have got your next thing. The next definition, what you should be aware of, is your spermatogenesis, what we are talking about. What is capacitation? So this is a term what you should be knowing it. It is the process of activation of sperms in the female genital tract. So once the fertilization has happened, the spermatozoa will go into the fallopian tube, and how it becomes active over there, that is the process is called capacitation. So here, when the spermatozoa goes, the outer covering of it gets removed. The glycoprotein coat gets removed, and then it becomes the acrosome with seminal plasma proteins, and form the, with the help of plasma membrane, they form very potent. Next is acrosome reaction. So this is a reaction that occurs after binding to zona pellucida and induced by zona protein. So this is the later stages of development. So now what is oogenesis? So these are all definitions, terms and all. It looks very easy when you read it by definition, but later on it can become a little complicated if you don't know the exact terminology. But this is the chapter which you are studying from your school days, so there should not be any problem. So oogenesis, the process by which the oocytes are produced in the ovaries, are called oogenesis. So the oocyte is the smallest cell, so that size is 120 micro in diameter, and it will be active for a period of 24 hours only. So during that time, if fertilization happens, then the conceiving takes place. So this is the diagram, what you should remember it. The fertilization, the process of male and the female gametes or the pronuclei, when they fuse, they results in the formation of zygote. So that is the fertilization. So you can very well appreciate in the diagram also. So the outer covering layer is called zona pellucida. This is the zygote. And then inside at the center there will be nucleus. Then what happens, the male and female, once they meet, then the cell starts dividing into 2 stage, 4 stage, 16 stage. So like that, stages are getting multiplied. We got 4 cell, 8 cell, 16 cell stage. The 16 cell stage, what you're seeing here, that is called as morula. That is an MCQ question. And then later, this blastomeres, what you are seeing, it will go towards the pole, and then a cavity-like structure develops here. So the zona pellucida and the inner cell mass, they get attached, and the cavity what is formed is the blastocele. That is the where the cavity filled with liquid blastocyst will be formed. So what we have learned so far, morula is a 16 cell stage, and on 3rd to 4th day of fertilization, zygote reaches the uterine cavity. The uterine cavity, it is reaching by 3 to 4 days. Then what is pre-organogenesis period? The development of an embryo from the fertilization up to the formation of bilaminar disc. So this is the stage of development. Up to bilaminar disc, whatever happened before that, that is called as pre-organogenesis. The organs are still not developed. Then the gastrulation, the gastrula formation begins in the 3rd week. Embryonic period is 3 to 8 weeks. These are all MCQs. The embryonic stage lasts for implantation for 2 weeks until 8 weeks of pregnancy. So 8 weeks of pregnancy is the one very crucial. The first 2 weeks are also called as geminal period, geminal period. 3 to 8 weeks is the critical period. I told you up to 2 months is the critical period for organogenesis, during which all the major organs develop. So in MCQ, they will give you critical period for organogenesis and the number of weeks, 3 to 8 weeks, which is extremely important. Then the blastocyst, what you're seeing here, the cavity, that is called blastocele, and the cell overall is called blastocyst. So here some of the central mass cells of the morula, which is a 16 cell, they will degenerate and form a blastocele. So a liquid will be filled here. Then here The cells are called as inner cell mass. They will go up to the one pole, one different corner, one particular corner in the north or south pole. They will go, and this inner cell mass is the one which develops into embryo. So the embryo is formed by inner cell mass, and this end towards which the inner cell mass moved and it got connected, that is called as embryonic pole. Embryonic pole. Then you have cells at the outer layer, that is called as outer cell mass, and the remaining cells around the inner cell mass are the blastocysts that will form. So outer cell mass from the trophoblast. So from the trophoblast, later zona pellucida, it will be there. So bilaminar disc. So as I told you, up to bilaminar disc formation, it is called as pre-organogenesis. So cells of inner cell mass which went up to the embryonic pole, they will differentiate into three types of cells: epiblast, hypoblast, and bilaminar embryonic disc. Epiblast are the columnar cells which surround the amniotic cavity. Hypoblast is lined by cuboidal cells which surround the primary yolk sac. It's like figure of 8. So please go back and see your textbooks. Then you have got bilaminar embryonic disc where there is an overlap. It's a flattened circular structure formed by hypoblast and epiblast. So bilaminar disc, two types of cells are seen: hypoblast and epiblast. Then externally, it is called as extraembryonic mesoderm. It's seen between the outer trophoblast and the inner amniotic cavity. The figure of 8 structure in your Indrajit Singh book, you can find all those things. So the outer structure is formed and it is called as somatopleuric mesoderm, and the inner one is called as splanopleuric mesoderm. And the extraembryonic coelom, the cavity which develops outside, is seen between them and it appears in the second week of the gestation. Next is your trilaminar disc, and the most important one is primitive streak. Extremely important, you should know this. So this primitive streak, or it's a proliferative zone appearing on the third week of development, and it is seen towards the caudal end of the embryonic disc. So there is cephalic end, caudal end. Cephalic is towards the head, caudal is towards the tail of 12 o'clock, 6 o'clock position. So this is the caudal end, which is your 6 o'clock position. The intraembryonic mesoderm is formed by the cells of the primitive streaks. They migrate laterally between ectoderm and mesoderm. That means between the ectoderm and the endoderm, one more structure is coming, and the cells are absent in procaudal plate. So this intramembranic mesoderm formation, it's mesoderm, it's in middle. It is between the ecto and endo. The mesoderm will come in between, middle. So they form a pear-shaped trilaminar disc. So this disc is the place where ectoderm is there, endoderm is there, and mesoderm is there. That is called as pear-shaped trilaminar disc. So that is an important MCQ. Next is your notochord. Notochord is a structure which divides your body into two halves. It is your midline. So that is why we are unilateral. See, we are bilateral. Our left hand and right hand looks similar. Our left eye and right eye almost look similar, even though they are not, but almost they look similar. So that is why the importance of this, it is there. So next is notochord. The epiblastic cells invaginate from the primitive nodes to form the notochord. So the epiblastic cells are responsible for this, and the notochord forms the central axis. I told you the midline of the embryonic disc, and it gives a bilateral symmetry. So that's why the human beings, or we are our left and right sides look similar because of the perfect division of the notochord. And our nervous system develops between 18 to 23 days of fertilization. 18 to 23 days. These are all high yielding facts which you should know. Then the neural tube gives rise to the brain and the spinal cord. It is up to 23 days. And then the neural tube is divisible into cranial part that forms the brain and a caudal part which forms the spinal cord. So you got the brain and you got the spinal cord. The primordia for the craniofacial complex develops from Henson's node. So please make a point. Henson's node is the point from where craniofacial, the complex develops. Henson's node. So derivatives from the neural crystal cells, all the structures are derived. They come from the neural crystal cells. It's a list of cells. You can read this. It is an important MCQ. Some of them may be asked the derivatives of neural crystal cells. Next, coming to the stages of embryonic craniofacial development. So at what day, what happens? And if that normal thing does not happen, a syndrome will develop. The clinical application, what is it? So up to 17 days time, germ layer formation and organization happen. 17 days is the normal. In this 17 days, if there is a problem in germ layer formation and organization, the child or the embryo, or later on when the child is born, it develops into fetal alcohol syndromic patient. 19 to 28 days, there is origin, migration, and interaction of the cell population. So all the cell population, they are on the 18 to 19 days. So what happens if 18 to 19 days again there is a problem? Then what happens? There is a syndrome. And what is that syndrome? The syndrome is, again, just a second. Yes. So we were discussing about the tables. (19 to 28 days), hemifacial microsomia, mandibulofacial dysostosis, and the lip abnormalities they develop. 28 to 38 days, primary palate formation occurs, and if there is a defect in that, cleft lip and palate develops. 42 to 45 days, secondary palate formation occurs, and in this stage, if there is a defect, cleft palate develops. So all this data is very important. These are all MCQs kept into a table. And day 50 till birth, if there is, that is the stage in which final differentiation of tissues occur. Then if there is a defect in this stage, then achondroplasia, synostosis, Crouzon syndrome, and Eppert syndrome happens. So you should know the germ layers, ectoderm, endoderm, mesoderm. In these three layers, the derivatives of all the three layers are extremely important. So let us go directly to the derivatives. The derivatives of ectoderm is your skin, hairs, your nails, your sweat, what it comes, and sebaceous glands and mammary glands. So they are all derivative of your ectoderm. The central nervous system, retina, optic nerve, epithelium of lips, cheek, gums, floor of the mouth, lower part of anal canal, and terminal parts of urinary and genital tracts, the lens of the eye, and your peripheral nervous system. They are all derivatives of ectoderm. So an MCQ can be made from this. Similarly, you have got parenchyma of the liver, pancreas, thyroid, parathyroid, thymus, epithelium of GIT, primordial germ cells, urinary bladder epithelium, and the list goes on. So please go through this. You will have to answer MCQs from this. You cannot go wrong. So the question is, the primary germ layer endoderm is derived from. So we have just discussed right now. The endoderm, the primary germ layer endoderm is derived from basically from yolk sac. From the yolk sac only, everything comes. The story begins from the yolk sac only. Then is the placenta. What is placenta? It is a discoid shape of diameter with 20 centimeter. So when the baby is born, the whole placenta has to be shed off. So it is the maternal surface, raw and rough surface, in which 15 to 20 cotyledons are present. So it will be connecting with the fetus also. It is the structure of the mother. It will be connecting to the child. So there is a fetal surface and there is a maternal surface which is connecting to the mother. So the fetal surface, it will be smooth, whereas maternal surface, it will be rough. And here the macrophages are seen, tissue macrophages are called as Hofbosser cells. Hofbosser cells, an MCQ, what you should be knowing this. Coming to the functions of placenta, you have got nutritive function, excretory function, respiratory function. So it is basically, it is protecting the child, right? So nutritive, excretory, respiratory, dialyzing, metabolism, and secretory functions. So these all functions are there. So you should know all the functions and how it does also. It just knowing the name doesn't affect. You should know the how it does also. So next, coming to pharyngeal arches. So pharyngeal arches, initially 6 arches are there, but after some time the 5th arch becomes rudimentary and it goes off. And you should know what are the structures developing from the 6 arches. So in each arch, there will be one muscular component, then there will be one artery, then there will be one nerve. So this structures, each derivative, you should be knowing from where what develops. Otherwise, it's going to be, and this is the part which comes in almost all the exams. So this part you should never miss it out. So there is first arch, second arch, third arch, and your 4th and 6th arch. So there is a muscle, skeletal element, nerve, and artery from each arch. So the first arch, muscular components of muscles of mastication, mylohyoid, anterior belly of gastric, tensor belli palatini, and tensor tympani muscles of the soft palate. Then coming to the skeletal element from the first arch, you've got maxillary swelling, so maxilla, mandible, incus malleus, anterior ligament of malleus. So these are the directly the question will be given. It is derived from the which arch. And the nerve supply of the first arch is the mandibular division. That is why it is also called as mandibular arch. Then the artery is maxillary artery. And then here Meckel's cartilage also developed. They are the cartilage of the first arch. Incus and malleus are derived from its dorsal end, and from the ventral part of the cartilage, developing mandible is absorbed. Sphenomandibular ligament and anterior ligament of malleus also derived from the Meckel's cartilage, and it is from the first arch. The second arch, the muscular component, you should know all these names. Muscles of facial expression, your 17, 18 muscles, auricular muscles, your frontoccipitalis, platysma, mylohyoid muscles, in different places it is there. And the skeletal elements, rickets, cartilage, stapes, the 5S, stapes, styloid process, stylohyoid ligament, and your lesser cornu of the upper body of the hyoid bone. These are all structures present in the second arch. Then the nerve of the second arch is called facial nerve, 7th cranial nerve. So that is your nerve of that arch. And the artery is stapedial artery. These are all MCQs which you should learn that. Third arch muscular component is stylopharyngeus muscle, and skeletal elements is your hyoid bone, that is greater cornu of hyoid and the lower half of the hyoid bone. Nerve is glossopharyngeal, and right and left common carotid artery. So basically this is the table which is there in your dental pulse book or any MCQ books you read. One table is there. You should know first, second, third, fourth, 6th arch derivative. So I hope you will go through this. This is the table what I am talking. There is artery, there is a muscle. The muscular component you should know first. Okay, the muscular component you should know first. So that is why muscles are the ones where exceptions will be there. Anterior belly of digastric is from one part, and the posterior belly of digastric is from the another part. So that is why the confusion should not happen. Okay. Just a second. So basically the muscles only, which gives you confusion, and all the MCQs you will see with your experience, it's from the muscles they ask that. Okay. Next, coming to, so what we have discussed so far, we have discussed the fertilization, right? The fertilization, the different terminology we have discussed, and then we have discussed our blastula, morula, notochord, primitive streak, and then we have discussed about the formations of the pharyngeal arches and the derivatives of the pharyngeal arches. Okay, so now coming to the next part, that is your development of your tongue, thyroid gland, your face, and your joints. So that is what in brief we will discuss that. So coming to the first one, development of your, just a second. So this is the first arch, second arch, third arch, fourth arch, sixth arch, the table what I told you to remember that you should know. Okay, now coming to some of the basic questions from the joints. So what is synchondrosis, what is symphysis, and what is synostosis? The first one, synchondrosis, is C is there. So it's a joint between two cartilages. A plate of hyaline cartilage connects the bone at the joint. So between two joints, if there is a cartilage, it is called as synchondrosis. So joint between ribs and sternum comes here. And then next is your syndesmosis. So syndesmosis, it's desmosis parodontal ligament, desmodon. So a long cord of sheet or dense fibrous connective tissue is there in between. Fibrous connective tissue or ligament is there in between. Example is radioulnar joint, comes under syndesmosis. And next is gomphosis, which you have already studied in your DADA. It's a peg in socket from fibrous joint. So here the articulation of the teeth in the alveolar socket, the joint is called desmodon. So that is what you should be knowing very well. These are the definitions which comes in your exams, which you have to give an example what it is. So the first arch, second arch derivative, this you should know. And then the pouches, the pharyngeal pouches, from the first pouch, second pouch, third pouch, what all things are coming, you have to know that very well. Otherwise, it isn't. Pharyngeal arches and the pouches. So these are the ones which comes in the exam. If you know that, your things are solved. Yes. Next is your development of palate and lips. So let us go for the palate first. So development of palate, there is primitive plate. Two sticks are there. The primitive plates will mix and primitive stick will be there, right? So the left and the right, the formation of the frontonasal process which comes here. So before going that, I'll just go into development of. Let us do one by one. Okay. So this pouches, I told you to learn the table. Fine. Yeah, this is very important. Anomalies of the pharyngeal pouches and the clefts. This anomalies is very important. There is something called as DiGeorge syndrome, Neslov syndrome. These syndromes you should know. You can take a screenshot of this. So DiGeorge syndrome is the third and fourth pharyngeal pouch syndrome. What happens here? There is thymic hypoplasia. And then you have got thymic hypoplasia. And then selective T cell deficiency will be there. T cells deficiency. And it's Neslov syndrome, failure of development of third pharyngeal pouch. So only superior parathyroid will be present, inferior parathyroid will not be there. Absence of T lymphocytes. So brachial cyst and internal fistula can develop over here. So that is very important, you should know. So then coming to the development of the face, basic structures you should know. So development of face, you have got the mandibular arch and your maxillary, mandibular process and the maxillary process, you can call it. So the bilateral mandibular process, they will go and meet against each other. So it's very simple thing. Mandible is derived from one single process. Whereas the maxilla, it is derived from 4 processes. So what are the 4 processes? Your maxillary process, lateral nasal process, medial nasal process, and frontonasal process. So that is why there is lot of clefts in the lip or in the upper arch. Compared to the lower arch, more clefts are seen on the upper lip and the palate. Okay, so that is very important. So you should know a little bit about definition, so the classification of the cleft lip and palate here. So that is very important. Then you have got nasal placodes, lens placode, your external ear. This all comes at the later stages of development. Then coming to anomalies of the skull, you have got anocephaly. Greater part of the skull vault is missing. Major part of skull is not there. Cephalocephaly. That means early closure of sagittal suture, acrocephaly, primitive closure of coronal and sagittal suture, plagiocephaly, premature closure of coronal and lambdoid suture, microcephaly, the brain fails to grow and the skull fails to expand. So these are all anomalies of the skull. So definitions and all you should know. Brachiocephaly, very small, premature fusion of coronal sutures. Dolichocephaly, long and thin skull. Congenital hydrocephalus, the cranial vault bones are widely separated. So there is a space. The sutures are not fused. So these are the terms what you should learn. Development of face, as I just told you, in the 4 weeks, 28 days, it starts. It starts with frontonasal process, simultaneously mandibular arch, and this you have been studying from a very long time. You have got the premaxilla, frontonasal process, medionasal process. The maxillary process fuses with the lateral nasal process. Lateral will fuse with the medial nasal process. Medial nasal process will fuse with the frontonasal process. The frontonasal process forms a philtrum. So this you have studied again and again. So I'm not going into the details of that. Palate development 6 to 12 weeks, and the two palatal process and the primitive palate, they will fuse. The three things, three structures will come and three plates will come and meet. This is what I was talking. The palatine process and the frontonasal process. So the formation of the secondary palate takes place between 42 to 55 days of gestation. So this you should know the timing. The timeline is very important. Upper lip, the four processes meet. Lower lip, the mandibular process. And if there is cleft lip and palate, the syndrome what is more common with the lip, with the lower lip problem also. And there is also cleft lip and palate, which is called as Van der Waals syndrome. So please note this, take a screenshot for this. Then this are the various anomalies of the face and the palate. If one side unilateral cleft lip is there, then what is the pathology? Midline defect is there, why it happens? So basically, they will give you the right hand side. The pathology part will be framed as question, and the left hand side you need to mark as answer. Either way you can study. Then the definition, basically what is microstomia, what is Peaches Collins syndrome. These are all the clinical aspect or what happens because of defect in the formation. Development of tongue, the first, third and fourth arches, these three arches takes role in that. Anterior 2/3 of the tongue is derived from the mandibular arch. It is formed by the fusion of the two lingual swellings and one tuberculum impar. Then posterior 1/3 of the tongue is formed by the third arch. And the most posterior part of the tongue is by the fourth arch. You can see that the second arch is also there, but it sinks between. So only 1, 3, 4 are the ones which forms the dorsum of the tongue. So again, you should know a little bit of the structure of the tongue, which is your gross anatomy. It doesn't come under embryology, but your arches 1, 3, 4. And 2 will come and it will go very fast. Okay. Then is your joints. So joints again, there are fibrous joint, cartilaginous joints, synovial joints. So the different types of fibrous joints are, example, suture, syndesmosis. You can see here what is the difference between both of them. A non-synovial joint with connective tissue in between is called brachiocephaly. So that is how I told you. They will ask you the definition, tell you what is the answer for that. So these are the features: syndesmosis, gomphosis, everything in chondrosis, which I have just explained. And what is the example for that? You should be knowing that. Upper and lower lips are formed from which embryonic process? So it is maxillary process and the mandibular process and the maxillary lateral and the medial nasal process. The same thing I told you. Mandibular process from the lower arch or lower lip. Upper lip is formed by the maxillary process, lateral nasal process, and medial nasal process, and in the center, frontonasal process. And the joints I have already told you. Right. So these are the basic things what I have explained today. The major intention of today's session is not to teach you everything, majority of the things you know, just to show you the areas where the questions are being asked. So please pay more attention to your pharyngeal arches chapter and the pouches and its derivatives, formation of the tongue, palate, and your the very first chapter, that is your fertilization chapter. A little bit about the chromosome structure and all. Chromosomal abnormalities, I recommend all of you to learn about that. And do your past question papers. Majority of the questions in embryology are generally repeated. Okay, so that's all for the day. Go through this. I recommend the book of Inderveer Singh. That is very important. One reading should be there, and embryology is all diagram based. It is not MCQ based, it's all diagram based. So once you see the diagrams, you can learn it. So read it diagram based, get an overview of that, it will work. Okay, and MCQs, lot of MCQs. Whereas it's coming for anatomy, there are dedicated books are there where only anatomy questions are there in the mark. Like subject wise books I'm talking about. So you should go and find out which are subject wise books. So anatomy, physiology, biochemistry, like the subject wise books, small books are also available. So this books will go into the depth of each chapter because it is only anatomy, it's only physiology. So if you do like that, your knowledge in the subjects will go very well. So I suggest you first you read the dental pulse book, then you go to Gauri Shankar, then your Neeraj Vardhavan book you go, and then Mudit Khanna Ashish Gupta, if time permits, you should go. This is how your standard of anatomy will increase. Directly you go to Mudit Khanna Ashish Gupta, you can't solve that because step by step you need to go up. So the books which I told, please make sure you have a soft copy of that. Okay, so that's it. Thank you. Thank you so much.